hiatus hernia is when the esophagus, which is the food pipe, passes down through the diaphragm, a sheet of muscle that separates the abdomen from the chest. And as it does this, it leaves a weak spot. And a hiatus hernia is when the stomach can pass up through that weak spot up into the chest and cause a number of symptoms. Most commonly, it's your stomach that passes up through this area, but other organs like the colon or the pancreas can also do it. But by far the commonest organ that does this is the stomach. Surgery for a hiatus hernia is recommended if patients are symptomatic despite taking medications. The symptoms that patients can get from a hiatus hernia are most commonly reflux, but it can also cause difficulty in swallowing and breathing trouble as well. If a patient is experiencing symptoms, they would come and see a surgeon in clinic. The purpose of a clinic review is to discuss the patient's symptoms in more detail and also to arrange for specialist tests like an upper GI endoscopy or an esophageal physiology, which will help us to objectively measure the degree of symptoms that are being experienced. If the tests are positive, we will then recommend an operation as a means of improving patients' quality of life and symptoms. An operation on a hiatus hernia is normally carried out as a keyhole procedure. You will come into hospital, be seen by the anaesthetist, and have a general anaesthetic administered. By performing keyhole surgery, we would make either 4 or 5 small incisions across your abdomen and use a camera and instruments to repair the hiatus hernia. The operation involves freeing the esophagus and the stomach up from the hernia and bringing it back down into the abdomen. We can then reinforce the diaphragm with either sutures or a mesh, which is less commonly used, and then a number of different approaches can be used to stop the hernia occurring, either wrapping the stomach around itself, which is called a fundoplication, or utilising a novel device such as a lynx in order to prevent future reflux from occurring. As with any operation, hiatus hernia surgery is very safe if it's performed by a surgeon with appropriate experience and expertise. For most patients, their recovery will be very smooth, and this operation is normally associated with a single overnight stay in hospital. There are complications with this operation, as with any surgery, and they can be severe if they occur. So we always talk to patients about problems related to bleeding during the operation or damaging the important structures that are involved, such as the esophagus, the stomach, the liver, and the spleen. If any of these complications were to occur, your surgeon would deal with them at the time, but it may require a longer stay in hospital. That said, however, a vast majority of patients have a very smooth recovery and go home without any problems. There are some long-term consequences of having hiatus hernia surgery, notably difficulty swallowing and bloating, and that's why we perform a number of tests beforehand to make sure that you'd be the appropriate candidate for an operation. The recovery following hiatus hernia surgery for most people is very smooth. You will spend approximately 1 night in hospital after the operation, and you'll be discharged home with painkillers. For almost all patients having this operation, we recommend a modified diet for at least 4 to 6 weeks after the operation, and we will go through this with you in detail at the time. But essentially it involves building up from a liquid-based diet through to introducing more solids over the coming weeks. We don't recommend eating bread or red meat for at least 6 weeks after the operation. However, most patients are fit enough to get back to work after a couple of weeks. Most patients experience really effective long-term relief after an operation. The aim of an operation is to have you off medication and eating without restriction. There are a number of patients who can get recurrent hiatus hernias, and we know that the highest risk time for this is either in the immediate post-operative period, which is why we recommend a modified diet after the operation, or in the longer term. So we quote a figure of approximately 10 to 15 years before some patients may begin to experience symptoms again.